Hello, this is Dr. Salem again about the breathing. Okay, the right way to breathe is when you inhale, the diaphragm goes down, pushes the abdominal viscera down. When the diaphragm goes down with inhalation, the belly should get bigger because the belly, you're moving the abdominal viscera, you push the abdominal viscera down. This is the prime mover or the main engine that enhances the intestinal and the gastric peristalsis to properly digest and absorb food. Not only that, it pumps also the lymph node, the mesenteric lymph, that pump the lymph node to come up again, to come up to the liver and go back to thoracic duct. So it helps the pump the lymph. It also, when you do diaphragmatic breathing, the diaphragm goes down, it pulls the mediastinum down, pulling the heart down. It will elongate the heart a little bit. The heart to come down with the mediastinum, with the diaphragm going down. This pull in the carotid arteries that will pull, that will help and enhance as well the cerebrospinal fluid pump from the third and fourth ventricle. So that's very crucial, the right way to breathe, the relaxed diaphragmatic abdominal breathing. So many people say no, it's not right. When you breathe, your belly get bigger. Who said belly get bigger is wrong? It's not the belly get bigger. When you inhale, diaphragm goes down. With inhalation, belly go forward. With exhalation, belly gets smaller again. But don't move your chest, don't move your shoulder when you breathe. We did this with my brother. The other way is when you breathe, don't move your belly. You move your thorax, you move your shoulders. You're using your neck muscles, mainly the scalene muscles. When the scalene muscle gets spasmed, the scalene is actually like three parts: anterior, middle, scalene, and it comes from the head, go down to the first rib. If you imagine the first rib is here and the scalene is here, the scalene pull the first rib up like this bucket handle motion to increase the vertical dimension of the chest, to increase the lung volume. When this happens, we keep working using the scalene all the time. We have the neurovascular bundle. It travels between the anterior scalene and middle scalene here. When the scalene contracts, spasms to squeeze the neurovascular bundle between the anterior and middle scalene. The soft squeeze, like scissoring, which could be easier. But also the neurovascular bundle passes again between the clavicle, collarbone, and the first rib. And when the scalene pull the first rib up, it squeezes again the neurovascular bundle between the collarbone and the first rib, which is bony compression, which is a little harder. And this can be treated in so many ways. You can check my CDs, treat your pain, restore your function. I explained in details. Today, I just want to show you now how to practice a proper way for breathing. My patient is the first time we're working at breathing today. So you're gonna just, when you inhale, be sure that belly moves forward with inhalation. Don't move your chest, don't move your shoulder. Here's my first visit today. Working at breathing. Breathe, blow out. Good job. Inhale. Blow out. If you want to practice, you can one hand on the chest, one hand on the belly. Be sure no movement in the chest, no movement in the shoulder, only belly moves. Talk to yourself in your head. I'm not going to move my neck. I'm not going to move my head. I'm not going to move my shoulder. I'm not going to move my chest. Only belly moves. With inhalation, smell rose from your nose. Belly gets bigger. Inhale. Blow out. Good job. Again. Blow out. Great. You're doing wonderful. Inhale. Blow out. Okay. This is just a bad breathing habit. Now when you check the pulse, pulse is there. Put your hand behind your back, please. Pulse is here and strong. Believe it or not, I treated him with no pulse, real pulse, both sides. Just I showed him the diaphragmatic breathing, the pulse came back. Why? Because now he's not using the scalene, and the scalene spasm is better. It was very tight. Now it's softer now. This is just bad breathing habit by using accessory muscles and not using the diaphragm, which is the main muscle for the respiration, which is supposed to work. Only diaphragm when you're resting and relaxed. When people build up bad breathing habits, it is use the accessory muscles, keep working long time, it gets strained and it spasms, shortened to protect itself. So when it squeezes, when the muscle spasms, it blocks 3 vessels out of 4. It blocks number 1, the lymph vessel, which is the weakest to travel through, so it blocks the lymph, which drain the toxin from the area, so keep the toxin there, not drained. It blocks the vein, which is second weakest, so venous congestion will be there. It blocks the artery that give blood supply to the muscle. So one of the causes of the pain could be this, the ischemia, because the muscle doesn't get its own blood supply while it's contracting. It needs to relax its own blood supply. Keep practicing the breathing. It's easier when you're lying down. It's a little harder when you're sitting. It's even more harder when you're standing. It's even harder when you're walking, when you're working. And the first time I told my brother to practice 5 deep breaths, only 5 times every half hour you are awake. It could take up to 2 weeks, 3 weeks to get, because we need to revert a habit, a bad habit, bad breathing habit. People build bad habits, like people have bad eating habits, bad bathroom habits, bad sleeping habits. People sleep all day, wake up at night, the same as bad breathing habits. So try to fix your breathing habits, check it, it's gonna help you a lot. This video is very important, the information, so many people need it, so please share it as much as you can. If you like it, press like. If you're first time watching, press subscribe and stay tuned for more videos. Bye now.